Hello guys, my name is Vishnu and we as a part of DRX Pharma for You channel, we are coming with the next video. This is just actually giving you practical insights into Oxazolidinone antibiotics. So Oxazolidinone antibiotics usually consist of Linezolid, which is actually a reserve antibiotic as well because it is only used in conditions where it is at most necessary. Maybe it is a life-threatening condition, or maybe no other antibiotics are working based on the culture report. So there are a lot of things related to that. I'll be coming to that in future slides. So this short video will give you an insight into oxazolidinone antibiotics and what a pharmacist or a medical professional should know from the practical perspective. So when you look at the important cash points, these drugs are usually bacteriostatic in nature. As I hope you know, bacterio means bacteria, static means keep it in position. So bacteriostatic means they don't kill the organism, they only inhibit their growth. So these drugs, they usually bind to the 50S subunit of the bacterial ribosome. As a result, it inhibits translocation. Translocation means movement of any component or any content inside. So here, inhibition of translocation means they inhibit the movement of protein molecules. So as a result, protein synthesis is inhibited. So as a result, it shows bacteriostatic effect. So this is the mechanism of oxazolidinone antibiotics. These drugs are actually bactericidal against streptococcus. So that is one exception. Usually against other vulnerable organisms, they are bacteriostatic in nature. But when it comes to streptococcus, they have bactericidal effect. The problem with this antibiotic is that the spectrum of activity is very narrow. The risk of side effects is more. And also it has a risk of resistance also. So the spectrum of activity is usually limited to gram-positive organisms. As you saw in the second point mentioned here, streptococcus is a gram-positive. So like that, there are many other gram-positive organisms against which it has activity. It can be a staphylococcus also. So linezolid is usually used for the treatment of MRSA, that is methicillin-resistant Staphylococcus aureus. VRSA, that is vancomycin resistant Staphylococcus aureus. Actually, earlier there was methicillin resistance, so MRSA used to come. And if you are having MRSA infection, penicillins will not work, cephalosporins will not work, monobactams and carbapenems also don't work, except 5th generation cephalosporins. As you may have read in your book or something, there are 5th generation cephalosporins, which have come very recently. Ceftaroline fosamil, ceftobiprole medocaril, and ceftolozane. They are highly active against MRSA. So usually till now, the guideline used to say that if you are having an MRSA infection, usually vancomycin is the drug of choice. But now we have vancomycin resistant strains also. So in case of vancomycin resistant Staphylococcus aureus, we can use linezolid. We can also use in VRE. VRE is vancomycin-resistant enterococcus. So as you can see, enterococcus, streptococcus, staphylococcus, all these are gram-positive in nature. It is also a second-line choice in tuberculosis, but again, it is a second-line choice only because tuberculosis, as you know, is a very chronic disease. And depending on the comorbidities and the resistance pattern that you have, it can take months of therapy to actually get cured from it. Even people who get cured from tuberculosis also have long-term complications depending on their immune status and the extent to which the lungs are damaged. So linezolid is actually a second-line choice because of the risk of side effects, especially in long-term use, because in tuberculosis, we need long-term therapy. And it is also used against nocardia species. So in nocardiosis also, linezolid is a good choice. So this is just the limited idea about which are the conditions or organisms against which we can use Linezolid. Coming to the problems of Linezolid, it can cause bone marrow suppression. Now, please remember, whenever we talk about side effects, always try to understand, don't just simply read the term and by heart it. Now, many people have a tendency that when they read side effects, there are so many side effects that they tend to by heart it, considering that everything is important. And in the end of the day, they don't remember anything. So as I said, this will only satisfy your exam purpose, but it will not satisfy your practical knowledge or how to connect things. So this YouTube channel is going to give you an insight into how to connect the dots rather than simply graduating from your college or simply clearing your exams. So here we have written that linezolid causes bone marrow suppression. So first of all, we have to understand what is the function of bone marrow. So bone marrow produces blood cells. So if bone marrow suppression happens, so it can lead to lot of problems because bone marrow produces RBC, bone marrow produces WBC, and the same produces platelets also. So if RBCs gets reduced, then your RBC count will get reduced, which can lead to anemia. If your platelets are reduced, it can cause thrombocytopenia. So you can add a practical knowledge with this, that if a patient is having severe bleeding and linezolid is used for a long time, it can cause more bleeding because of thrombocytopenia. And it causes reduction in WBC. So it can cause leukopenia. So this is very interesting. This you can check articles or you can check any websites. This is just my hypothetical idea that since it causes leukopenia, for example, in a tuberculosis patient where we have to use it for a long time, will it cause further infections? Because when WBC count reduces means your immunity reduces. So in that condition, it may lead to further infections. So I have put it as a question mark for you to refer and let me know. Please remember, these side effects are not meant for short-term dosing or maybe a single dose or 2 doses or something. This usually happen in long term. This may happen in long term and obviously in selected population who are already having these side effects. For example, if a patient is under cancer chemotherapy and that patient is having significant bone marrow suppression, linezolid may add to it. Thrombocytopenia is usually the most common ADR that is found. So as a result, this patients under linezolid therapy should be regularly monitored for platelet counts. This drug causes mitochondrial damage. So this is another practical knowledge that you can connect because many areas, especially if you have studied toxicology, in most of the poisonings of heavy metals and many toxins, you may have studied in the pathophysiology of that poisoning that it destroys mitochondria or it damages mitochondria. So always remember, when the mitochondria is damaged, a large number of things happen, but the most common thing that happens when mitochondria is damaged is lactic acidosis. So lactic acidosis is a very common side effect that is seen when the mitochondria is damaged. So you can now check for other medicines which damage the mitochondria so that you can also connect this side effect to those medicines. So linezolid causes mitochondrial damage, which can lead to optic neuritis. You may have heard this term for another medicine, that is ethambutol. And that is why ethambutol, which is a first-line anti-tubercular medicine, it should not be given to children below the age of 5 because it causes optic neuropathy. It damages it causes blurred vision and it may cause loss of vision as well. So if we are using in children below the age of 5, they may not be able to report blurred vision. So ethambutol is never a good choice for children below the age of 5. So this drug causes mitochondrial damage and it can lead to optic neuritis. It can cause peripheral neuropathy also. And this neuropathy is very interesting because there are a lot of types of neuropathy. Neuro means nerve, pathy means damage or disease. So whenever you are having damage in your nerve, always remember it causes a pain which is similar to electric shock. So you will get sudden pain and that pain will be like somebody has ignited a fire there. Because patients who report neuropathic pain, let it be any kind of pain. It can be trigeminal neuralgia, it can be post-herpetic neuralgia, it can be glossopharyngeal neuralgia, whatever, or it can be diabetic neuralgia also, diabetic neuropathy also. Most of the patients report that they get burning tendency pain. It is like a stabbing, burning tendency. And after a considerable period of that burning tendency, they also report numbness in that area. They don't experience any kind of sensation. So that indicates chronic damage of the nerve. So this usually happens in diabetic neuropathy patients, in which if the blood sugar, especially the HbA1c level, is always consistently above 10, which indicates poorly controlled diabetes, this thing may be observed. So why am I telling all these things in connection with this is because this presentation or this video is not just intended for you to get awareness about linezolid or oxazolidinones, but also to connect a lot of things with it. Like for example, when I was telling all these things, I am telling about other conditions related to this also. So this is how you need to connect the dots, make a practical insight of yourself. And this is one strategy that I employ for good memory and practical enhancement. It can also cause lactic acidosis. Now, lactic acidosis you may have seen in many medicines, especially if you remember if you have studied in your first year biochemistry, we have a cycle called glycolysis. So in aerobic conditions, pyruvate is formed, and in anaerobic conditions, lactate is formed. So when you are running for considerably for a very long duration of time and you suddenly stop, you start experiencing a burning tendency in your respiratory pathway or something. And then if you drink juice or water or something, you feel better. Because oxygen supply is also there. You start breathing through your nose, so you feel better. So lactic acidosis is a condition in which lactic acid builds up in the body, or lactic acid builds up in the blood. So this can lead to a variety of problems. If lactic acid increases in your blood, it can cause muscle pain. If lactic acid builds up in your blood, it can cause the worsening of heart function. If you remember the pathophysiology of myocardial infarction, lactic acidosis leads to myocardial infarction. It causes damage to the myocytes. And if lactic acidosis means if you are suffering from lactic acidosis, then another thing that also happens is this medicine can also lead to burning tendency when you are breathing. When you are breathing, you will find difficult to breathe or burning tendency kind of, because acid is being produced. So these are some of the practical knowledge that you can remember. And you know a very famous medicine which is notorious for causing lactic acidosis in the long term, and that is metformin. And that is why metformin is not at all a good option for patients who are on CKD stage 5 or something like that, because lactic acid is usually eliminated by the kidney. And metformin is also, if the kidney is already damaged, the lactic acid that will be produced by metformin will not be eliminated by the kidney. So in that condition, lactic acid will develop or accumulate in the blood. So that is why this drug causes so many side effects. So it should only be used in resistant cases, and you should avoid it for long-term durations. Linezolid also has non-specific MAO inhibiting properties. So it also has a high risk of serotonin syndrome. So this is something that you are very familiar with, I hope, especially if you have studied toxicology and if you have studied antidepressants, then you know this very well. So linezolid actually has MAO inhibiting properties. So MAO, you already know, it is an enzyme, monoamine oxidase. So this actually reduces the levels of noradrenaline and adrenaline. So what does the MAO inhibitor do? It inhibits that enzyme. So as a result of which noradrenaline, adrenaline, all these things, or serotonin increases. So linezolid also has non-specific MAO inhibiting properties. That means it can inhibit two types of MAO. There are two enzymes of MAO. One is MAO A and one is MAO B. MAO A inhibitors are used in depression and MAO B inhibitors are used in Parkinson's disease. So linezolid has non-specific MAO inhibiting properties. So this medicine should be avoided with the following medicines mentioned below: SSRIs, selective serotonin reuptake inhibitors, tricyclic antidepressants, serotonin norepinephrine reuptake inhibitors, and MAO inhibitors themselves. Because if linezolid is used along with this medicine, then serotonin level will shoot up in the body and it can lead to life-threatening consequences. So that is one thing that we need to be very aware about. So from this also we can derive a practical knowledge that if a patient is suffering from depression and they are under SSRI, TCA, SNRI or MAO inhibitors, linezolid is not a good option for them. So this medicine is metabolized by non-enzymatic oxidation. This is very important. It has nothing to do with cytochrome P450 enzymes because it is metabolized by non-enzymatic oxidation. Linezolid actually has a very good oral absorption. It has almost 100% bioavailability, and it can be given both orally and parenterally by BD dosing. So it depends on the severity of the infection. We can give it as orally or parenterally as the situation demands. Now we come to a medicine which has been released, I think, 4 or 5 years back. This is a recent molecule. It is known as tedizolid phosphate. This is a newer oxazolidinone. This has been approved for MRSA and VRSA infections. So this is also similar to that of linezolid. But there are two benefits of tedizolid over linezolid. First is it has a very low risk of bone marrow suppression in comparison to linezolid. And it is longer acting than linezolid. So linezolid is usually given BD, but since this medicine is longer acting, it can be given OD also. Now we come to a molecule which is under clinical trials. So this is actually sutazolid. So this is an investigational oxazolidinone antibiotic. This is actually under clinical trials for the treatment of tuberculosis. So this is just an insight into what I wanted to tell you about oxazolidinone antibiotics. They are usually bacteriostatic in nature, but they are bactericidal against streptococcus. Main activity is restricted to gram-positive organisms. And their side effects, usually I always tell people, we can't estimate the occurrence of a side effect, how fast it will happen or how late it will happen. It depends on the patient's condition, pharmacokinetic status, kidney and renal function, and obviously drug-drug interactions, and many things come together to determine how fast the side effects will happen or how late it will happen. If we say it in a general perspective, oxazolidinones can cause bone marrow suppression, especially linezolid. So that is a bit of a matter of concern because this is also seen in chloramphenicol. This medicine can damage the mitochondria, which can lead to lactic acidosis, peripheral neuropathy, and also it can cause optic neuritis. So we can say the patients who are under linezolid therapy that if you are reporting blurred vision, if you are having any kind of blurred vision or something, then you must report to the physician or pharmacist. And if you are experiencing unexplained muscle pain, or if you are having difficulty in breathing or something like that, or increased heart rate, so in that condition also you should report to the physician or pharmacist because it may be a side effect of linezolid in the long term. So that's it I want to tell you, and thank you very much for viewing our presentation. This is actually a collective effort of the team involved in the successful uploading of this video in YouTube. Our perspective is completely diverse. We have a lot of ideas. We have enlisted a number of ideas which we can make videos in future regarding. And also we have, we want your suggestions also. Like for example, for any topic or any disease or any medicine, you want practical knowledge, because we are practical knowledge oriented people, because theoretical knowledge, notes, everything you will get from people. It is not a big thing. We have apps, we have social media, we have a lot of websites and pages and channels where we get notes. But those only satisfy your exam perspective. They don't satisfy your practical knowledge perspective. And definitely, as you know, as far as pharmacy practice in India is concerned, it is a big challenge because we have to learn a lot of things which are never taught to us or neither mentioned in the syllabus properly. So I hope you love this video. If you like this video, then please press the like button. And definitely, if you find this video informative and worthwhile, and if you are getting the message that I want to deliver to you, then please share it with other people, because this is not just for PharmD, it is for other medical professionals, and people from any medical professional can get benefit from this presentation. We have made it in a generalized perspective. Thank you so much. Keep watching and keep subscribing. Thank you.